In the hazy corridors of history, a chilling chapter unfolds, revealing the haunting reality of mental health treatment in the 19th century. Within the confinements of asylums, where hope intermingled with despair, an obscure method of control existed: the use of blindfolds and restraints on patients with mental illnesses. Imagine being stripped of vision, your world shrouded in darkness. This was the unsettling reality for countless individuals grappling with mental health challenges, confined within the walls of asylums in a bygone era. Welcome to a window into the past, where a haunting history of mental health treatment awaits discovery. In the unforgiving landscape of the 19th century, perceptions of mental health were entangled in a web of misunderstanding and stigma. The prevailing societal attitude towards individuals grappling with mental illness was often one of fear and ostracization. Rather than being viewed through the lens of medical science, mental health was often misunderstood, wrapped in superstition and misconceptions. Those suffering from conditions we now comprehend as mental illnesses were often perceived as untamed souls or dangerous entities, feeding into the culture of fear and discrimination. The lack of scientific understanding contributed to the perpetuation of myths and flawed perceptions. Mental illness was often considered a mark of moral failing rather than a medical condition, leading to the harsh and often punitive treatment of those affected. With minimal understanding and no effective treatments available, individuals with mental health challenges found themselves confined within the walls of asylums, subjected to the societal norms and misinformed beliefs of the era. Overcrowded wards, inadequate sanitation, and a lack of personal space were common features. Patients often found themselves subjected to harsh and regimented routines, where the concept of personal autonomy was virtually non-existent. The asylum environment, though intended to provide safety, frequently instilled a sense of isolation, misery, and despair. It was a place where the suffering of mental illness intersected with the harsh realities of 19th century healthcare. The treatment methods employed within asylums were equally unforgiving. Restraints, seclusion, and the use of various physical interventions were common approaches to manage patients. The very notion of treatment often involved physical force and punitive measures. Patients, already grappling with the inner turmoil of their mental illnesses, were subjected to treatments that bordered on cruelty. The contrast between the compassionate care we advocate for today and the harsh methods of the 19th century is stark and unsettling. The enigmatic belief in sensory deprivation as a means of controlling behavior was a prevailing concept. It was thought that limiting a patient's sensory experiences, often by blindfolding, could potentially calm erratic behavior or reduce agitation. Within the asylums of that era, the idea that removing the visual stimuli could somehow mitigate or control the perceived unpredictability of those suffering from mental illnesses was distressingly embraced. At the heart of using blindfolds was the misguided perception of benefiting the patients. It was believed that restricting their vision might promote calmness or reduce their inclination towards distressing behaviors. However, the actual impact on the well-being of patients subjected to such treatments was far from the intended soothing effect. These reasons behind using blindfolds, although confounding from our contemporary perspective, reflect the stark misunderstanding and the distressing reality of mental health treatment in that era. Thank you for embarking on this journey through time with us. If you found this exploration thought-provoking, don't forget to like, share, and subscribe to our channel for more engaging insights into the world of health and well-being. Stay tuned for our videos, where we continue to shed light on the ever-evolving landscape of health and humanity.